Lawmakers at the State House are trying to right-size Medicaid. It comes as the cost to the state has grown by $5 billion over the last 4 years. WRTV State House reporter Meredith Hackler joining us now. And Meredith, I understand some people are concerned about legislation that has been proposed to get these costs under control.
Yeah, well, as you heard, that is a big number, Mark, and Senate Bill 2 has been made a priority by Senate Republicans, which creates work requirements for people on the Healthy Indiana plan. But it also requires all 2 million Medicaid recipients to do an eligibility check every quarter instead of once a year. Dozens of people signed up to testify on Senate Bill 2, authored by Senator Ryan Mishler, who says the Medicaid budget needs to be tamed.
Majority of Healthy Indiana plan members, for instance, 78% work, and those members of HIP who are not working already, they likely live in a household with workers, are full-time caregivers to children, are too sick to work, or cannot find employment.
Hoosier Action is concerned about the quarterly check-ins. So are Hoosiers using the plan. That's currently more than 680,000 people.
It's different for someone who's self-employed. My income fluctuates a lot from month to month. So if you just look at, maybe I had a really good quarter, but by the end of the year, it sort of all washes out and I'm still where I am.
Providers worry the quarterly check-ins could delay care.
A bill that makes enrolling for Medicaid more difficult for patients will lead to people losing their Medicaid and it'll lead to people getting sicker. And those people will then go get care at our ERs, which are already overwhelmed.
But Senator Ryan Mishler feels it is a step in the right direction to get the Medicaid budget under control.
You're going to see most of our new revenue in this budget is going for Medicaid, and that's going to take away from other programs and services. So I just feel we have to get Medicaid under control. This isn't the cure. I think it's one piece of a bigger puzzle that we have to work on with Medicaid.
One change to the bill was removing the cap of how many Hoosiers can be on the Healthy Indiana plan. Now, that cap had been 500,000, but it was removed today in committee, Mark.
Meredith, this bill also prohibits the advertisement of Medicaid programs. What exactly does that mean?
Yeah, I think we're still going to be figuring that out. You've probably noticed that the advertising for Medicaid programs, you've probably seen them here on our TV screen. Some lawmakers feel those shouldn't exist because they think it takes money away from the programs for patients. However, nonprofits and advocacy groups are concerned that portion of the bill will stop them from being able to share information about programs with people who are disabled or sick. It's something that will be examined as the bill moves forward. It did pass out of committee today, so I'm sure they'll be figuring that out once it gets to the House floor, Mark.
Yeah, another item to go back and forth about. Our Meredith Hackler live in the newsroom for us tonight. Thank you.